Also today, when it comes to diagnosing breast cancer, women are told to do self-breast exams and to get an annual mammogram. But did you know there is a type of breast cancer in which these methods don't work? That's because it's not as obvious as finding a lump. It is a rare but aggressive form known as inflammatory breast cancer, or IBC. Terri Ford Perez was recently diagnosed with IBC, and she joins us in our studio along with Dr. Rabia Bhatti of Resurrection Medical Center. Thanks for coming in today, ladies.
Thank you.
How did you find out you had this?
I found a rash on my breast, and I had it probably for 3 or 4 months before I thought it was rare, that it was on there so long.
What were you thinking it was?
I thought it might be from my bra or from the soap that I was using.
So just an irritation, you thought?
Yes.
Did it hurt or
Did
just
not hurt.
Itchy?
A little, but not too much.
And you didn't know anything about IBC?
I knew nothing about it at all.
Okay, so you went to see a doctor eventually because why?
I was going for my regular checkup, and I asked my doctor what she thought. She said, you just had a mammogram in January, but let's have another one just in case.
Okay.
So I had one on August 1st, and on August 15th, I was diagnosed with inflammatory breast cancer.
Okay, and this is a type of breast cancer that, as we said, is rare. And Dr. Bhatti, you're saying about 3 to 5% of women, if you can't find it with a mammogram, and you can't find it with any type of machinery or self-breast exam, what is a woman to do?
I think a woman has to know her breast. That's the most important thing, and has to be aware of the signs and symptoms of inflammatory breast cancer. Because basically, Sylvia, it's a clinical diagnosis. No other test will diagnose this condition as a clinical examination. The women should know that inflammatory breast cancer affects basically the skin of the breast. The tumor cells grow like little nests in the breast tissue. They don't form a mass.
There's not a lump.
There's not a lump. In about 50% of patients, there may be a lump. In the other 50%, there may not be a lump, but there'll be skin changes, skin rash, skin thickening.
And that's what Terri noticed. Now, we have a list up here that has just some of the symptoms. It talks about unusual increase in breast size, redness or rash, itching of breast, stabbing pain, feverish breast. It seems like this would be a hard thing to detect.
Absolutely, Sylvia, because I think we are not familiar with this condition. But I suggest that all women examine themselves, and if they know about inflammatory breast cancer, whenever there's a change in their breast, if they know their own breast, whenever there's a change, they will be able to go seek a physician's advice. And don't wait for more than 2 weeks. Bug bites or rash from a deodorant or detergent or even a skin infection should resolve within a couple of weeks. If it does not, go to a physician and ask them to do a biopsy to confirm or disprove the diagnosis. Majority of times, it's not going to be inflammatory breast cancer. So every time you get a rash, don't think like that.
And now that you know, do you think if you knew about this, because that's why you came here today, I should say you are so brave, you were just diagnosed, you contacted us. Maybe. If you knew then what you knew now, do you think you would know that this was wrong?
Absolutely, absolutely. And I think what's also important that, you know, sometimes we might not even see this rash. So if we wait until we get the thickening of the breast or other of the symptoms, it's already too late.
So don't wait. How are you doing, by the way?
I'm okay.
Yeah? Well, you are. She's incredible, isn't she?
She's amazing.
And as she said, we know you're going to do great. Thank you so much for coming in. We really appreciate it. And Alan and Linda, Terri just really wanted to be in here to let other women know about this IBC cancer that so many don't know about. So we thank her for coming in.
We admire her for it, and we thank her very much for getting that message out, too.
Important information, Sylvia and Terri.
Thanks very much.